Hello, everyone. Good afternoon, good evening. My name is Dr. Sarah Ellis. I am one half of the amazing host team here at the Functional Solutions podcast. Hello, Dr. Chill. How are you today?
I'm doing great. Dr. Sarah, it's so good to see you. It's been a while since we've done one of these.
I know. I was going to say, I haven't seen your face in forever. So happy to see you.
You as well. I'm excited
Yeah,
to be doing this with you today.
me too. Me too. So catch me up. How have you been?
Busy with practitioners, the clinical coaching sessions. It is nonstop. So
Yeah,
it's been great.
good.
And how about
Yes.
yourself?
Same, busy, so excited to be welcoming a new, fresh cohort of folks joining our clinical training program, helping with coaching calls as well. And yeah, busy with life, home life, and our own practices as well. So I'm doing good.
Multiple things, juggling multiple things. That's
All
what
the
we do
things.
as functional medicine practitioners.
That's right. That's
We
right.
find the multiple root causes and we juggle multiple things.
Yes, exactly, exactly. Speaking of juggling multiple things, today's podcast topic um, is unfortunately one that affects women who tend to juggle multiple things
Absolutely.
and wear multiple hats. And tonight we're going to talk about endometriosis. And it's so interesting. I've been having this conversation with patients a lot in my practice the last couple of weeks. We wanted to touch on endometriosis for a number of reasons, but it affects so many millions of women worldwide. And it is a chronic and very painful condition. If any of you have had the opportunity to care for women with endometriosis, or maybe you yourself or a family member or loved one has endometriosis, you know how greatly it impacts and can impact a woman's quality of life. And so endometriosis is a condition where the uterine tissue that is usually supposed to be inside the uterine cavity, it begins to expand and grow outside of the uterine cavity. And so that could be found on a woman's ovaries, her fallopian tubes, her pelvic lining, and even her colon or bladder. And so, just as that tissue may bleed or contract, and the normal responses that endometrial tissue will have during menses, women will also notice those same things in those areas where those tissue have grown. And so let's start just to get a better picture of how endometriosis impacts women. Let's take a look at an image from a 2021 review article in the journal Cell. Now, this highlights the many different symptoms associated with endometriosis. And you can see that it's not just localized to a woman's reproductive system. So we're going to start at the top and we're going to go clockwise. So, of course, as usual, many women with endometriosis often complain of severe period pain, heavy menstruation, and then there are some non reproductive symptoms that include fatigue, depression, painful urination, pain with defecation, constipation and or diarrhea, infertility, painful sex, and pelvic pain. Now, you may hear a common theme across these symptoms, which is pain. And those lesions that we talked about, where the different endometrial tissue grows on different parts of the body, when those lesions adhere to the colon or the bladder, then women will experience pain with urination, pain with having a bowel movement, and pain with sex as well. Of course, like we talked about, pelvic pain is the primary sign and symptom of endometriosis. Heavy periods, as well as bleeding between cycles or breakthrough bleeding, can also be a sign of endometriosis. Painful intercourse, as well as changes or difficulty with fertility, so struggling with infertility, and gastrointestinal symptoms as well, more commonly bloating and nausea. So let's take a look at an image from the Society for Women's Health Research, and it highlights some facts and figures on the impact of endometriosis in women. In this image here, we can see that endometriosis impacts 1 in 10 women of reproductive age. We talked about some of these common symptoms already, but that means we're looking at over 200 million women globally. Now, sadly, what we've seen is that 3 out of 4 women who are going in to be worked up and diagnosed with endometriosis, 3 out of the 4 of them will experience a misdiagnosis. And unfortunately, it can take up to 7 years to get an accurate diagnosis. Unfortunately, many women will come into your office sharing information about how they felt like they weren't heard or weren't seen, or have gone from doctor to doctor and specialist to specialist before being diagnosed. Not only is endometriosis a painful condition, a chronically painful condition, but it can impact, of course, a woman's quality of life, but her ability to have a healthy and thriving career. So the pain of endometriosis can take away 6 hours of productivity per week. And oftentimes, when we think of productivity, we think about careers and working, but this also can tie into a woman's home life as well. Now, on average, a woman with suspected endometriosis will see 7 different healthcare professionals, or have 7 different healthcare visits before seeing a specialist who specializes in endometriosis. And of course, down at the bottom, we can talk about the financial burden of on our healthcare system when it comes to endometriosis. But that is where we come in as functional medicine practitioners, because in our toolbox, we have a variety of tools and modalities to help address the root cause of endometriosis and help women improve their quality of life. So, as I mentioned, an estimated 1 in 10 women of reproductive age will have endometriosis or be diagnosed with endometriosis globally. It most commonly affects women in their 30s and 40s. And then approximately 1 in 3, or even 1 in 2 women with endometriosis will experience infertility. So, this makes endometriosis one of the leading causes of infertility around the world. So, what are some of the complications associated with endometriosis? So, endometriosis is more than just pelvic pain. It can definitely impair a patient's quality of life and affect their mental health. Many patients with endometriosis can often experience complications like adhesions and scar tissue, which can cause pain in areas outside of the reproductive system. Oftentimes, patients with endometriosis will also have painful ovarian cysts, have chronic inflammation. In fact, endometriosis is often associated with autoimmune conditions. It's been associated with the development of Hashimoto's thyroiditis and lupus. Now, when we look at the current drug treatment when it comes to pharmaceutical management of endometriosis, there are really 2 primary drug treatments, and of course, there are surgical interventions as well. So, generally, there are hormonal therapies like oral contraceptive pills and gonadotropin receptor agonists. So, as well as progestins. And these are all used to kind of suppress estrogen, but they're not getting to the root cause of why this patient has the excess estrogen that further facilitates the development of endometriosis. And then, of course, there's pain management. So, using NSAIDs, and in some patients with severe pain, opioids can be used as well to help manage their pain. And then, cervical intervention usually includes laparoscopic removal of lesions. So that being said, there's definitely a need for functional medicine practitioners to help support patients with coping with the pain of endometriosis, as well as addressing the root cause, which is usually estrogen dominance, but addressing that to help patients with endometriosis. So, in classic fashion, now that our brains are nice and warmed up, we have our juices flowing. Let's get ready for our first quiz. All right. Which one of these, what are the major factors that does not increase the risk of endometriosis? Number one, genetics. Number two, hormonal imbalances. Number three, a increased consumption of meat or a high meat consumption. Four, increased body weight. Five, a ketogenic diet. And six, autoimmune conditions. Let's see. Let's give you all a moment. You can hop in the chat. If you don't see an option to enter the chat, there should be a button where you can select watch on YouTube, and you can watch on YouTube and comment in the comment section. All right, the answer is number 5, the ketogenic diet. The ketogenic diet does not increase the risk of endometriosis. But we know that the other options do increase a woman's role or a woman's risk of developing endometriosis. Dr. Chill, what has been your experience with addressing endometriosis clinically as a functional medicine provider?
Here's the thing with being in this aspect, right, in this specialty, is that many of our patients are just trying to find answers that they're not getting answers to. Like you said in the statistics, they don't normally find this answer until they've been in 7 visits, right? That means 7 different doctor visits have failed to figure out what's going on with their pain, their fatigue, all of the symptoms that are associated with endometriosis, which could be many things, right? And so we're lucky because we get to actually investigate the root cause. And that's kind of what I'm seeing. What I saw in the clinic is that people came to us with this situation because they weren't getting answers. And then when you actually dive into it and investigate all of the different root causes, we would lead to the diagnosis of endometriosis after we looked at everything that was going on, right?
Mm-hmm.
Or they would come in with a diagnosis of endometriosis already and say they're not getting taken care of in that aspect. And it's because they're not looking at all of the underlying factors, right? And all of the underlying root causes. They may just be looking at their hormonal component, right? But they're not looking at all of these other aspects. And as a functional health practitioner, we actually have to address all root causes. And a lot of times it's multiple. There's multiple things going on. What is what is your experience with that?
Yes, same. And most often when women are coming into my practice, they are coming with the diagnosis, but it's been a long journey. They're often usually have a history of feeling unheard, or like their concerns were kind of passed off. And I have to do a lot of as I should, but definitely want to do a lot of listening and making sure that they feel heard and seen and validated. But just like you said, what I appreciate about working with patients with endometriosis is that it doesn't take a lot of major changes to cause good positive shifts when it comes to their symptoms. Um, Cleaning up their personal care products and making sure they're not getting a ton of endocrine disruptors, which is one of the root causes that we'll talk about today. Those sorts of things, changing their period products and, actually looking at their hormones and trying to balance them, can really take them a long way into kind of getting through all of that. Yeah.
Absolutely. And that's what we were going into this topic, right? Because we want to go into other factors that practitioners often miss, right? And one of them is going to be this main root cause, which Dr. Sarah touched upon, which is endocrine disruptors. This is a primary functional medicine root cause of endometriosis. It's the exposure and the prolonged exposure to EDCs or endocrine disruptors. These can be synthetic in nature or natural substances. What EDCs are is they interfere with hormonal function, and it's often by mimicking estrogen. Most often, this is a estrogen dominant type of condition, or it's blocking other hormone receptors as well. So let's take a look at an image and we'll kind of explain this a little bit further on how this works. And this was from a 2024 review article in the Journal of Immunological Tolerance and Regulation. What researchers found, they investigated the negative impacts associated with dioxin. It's called TCDD. This is a highly persistent and it bioaccumulates, and it's a major pollutant, and it's formed by a byproduct from industrial activities. And because it's extremely stable as a chemical and it likes to hold on to fat tissue, it's going to accumulate in the food chain, especially in some of our dietary fats, and it can remain in human tissues for years. And that's what this image is all showing, right? And when it holds on to the tissue, right, it can lead to inflammation of the endometrium, and it can block certain hormones such as progesterone that we're seeing there. It can lead to an increase of gonadotropin releasing hormone along with LH and FSH, which actually causes a negative feedback to our progesterone levels. And then it can also impact our liver with that bioaccumulation and cause an excess circulation of estrogen as well. And so what this study provides is it provides a really comprehensive review of how this exposure to this contaminant TCDD, and it's a potent dioxin and EDC or endocrine disruptor, it's going to adversely affect reproductive health through immune, hormonal, and epigenetic mechanisms. How does this happen, right? So let's just kind of dive into this a little bit further here. We talked about some of the estrogenic effects. So what EDCs do, like BPA, this is found in plastics. We've heard of that. Or phthalates, these are also found in personal care products. They have a high estrogen-like activity, and this can bind to estrogen receptors. It's going to activate certain pathways that's going to increase the growth and survival of endometrial-like tissue outside of the uterus. And then there is a hormone receptor activation. It's going to bind the estrogen receptors, ER alpha and ER beta, which we're seeing in that picture there. And these chemicals can upregulate estrogen responsive genes. This can lead to the proliferation and maintenance of ectopic endometrial tissue. There's also disrupted detoxification, which I mentioned earlier. It's going to overload some of our detox pathways. What are those, right? Those detox pathways are our gut, our skin, our liver. In particular, these EDCs are going to impact our liver detox pathways. And if you cannot metabolize estrogen properly, what happens? It's going to continuously circulate within the body, and it's going to cause those estrogen dominant type of symptoms. This can lead to endometriosis progression. And it's that persistent exposure to these EDCs, and it's that prolonged persistent exposure that can accumulate in body fat and then can maintain our chronic exposure as well. So how can we prevent this exposure, right? So let's take what you can do is look at your common household items. And these are going to be common sources of EDCs. The first thing is going to be plastic. These are going to be your food containers, your water bottles. So you want to take a look at your environment and your household and how often are you using plastic? If you're using plastic often and you're at risk for endometriosis, or your patients are at risk for endometriosis, you want to have them start to switch from those plastic containers to glass containers, right? Then you want to have them look at personal care products, such as their lotions and shampoos. Are they containing phthalates? All they need to do is send you a image of the ingredients in the back. If it says phthalates in there, you want to have them remove those personal care products from them. Other things are going to be pesticides. Are they eating a lot of foods that are high in pesticides, right? You can easily often have them refer to the EWG, it's ewg.org, and have them look at the Dirty Dozen list or the Clean 15. And this can help to reduce their pesticide exposure, such as the DDTs or the PCBs, because these are contaminated in our food. So having them remove those will be beneficial as well. And then household cleaners. Again, this is going to be some things like your detergents, their detergents, having them look at those detergents. And if there are nanophenols in them, having them discontinue that detergent and going into an alternative that doesn't have some of these EDCs. And this is going to help prevent and the accumulation of these EDCs, which is going to decrease the risk of endometriosis or help to improve their endometriosis over time, because it's going to take that total tox burden away from their liver. It's going to help to metabolize their estrogens, and it's going to help all of their metabolic processes function better, as well as improving their hormones, which are all the impacts of endometriosis.
Exactly. And think about all of the things you listed. I mean, everyday items, especially as women. I mean, we use our moisturizers every day, sometimes
Mhm.
twice a day, makeup, lipstick. Not only is it on our lips, but we're eating. And so we're kind of eating and drinking what's on our lips. So
It's that
so
chronic
glad that,
exposure,
yeah,
you know?
exactly.
And I
Yeah.
mean, these household products, they're the lotions, like you said, they're
Yes.
on your skin, they're being absorbed constantly, every
Yes.
day, all day.
Exactly, yes. Even, I'm so glad you talked about, like, laundry because, when I bring my patients in and we talk about, lifestyle changes, and we talk about these things, I mention dryer sheets, and
Mhm.
they're like, "Oh my gosh, I have to get rid of my dryer sheets," and it's like, "Yeah, because your clothes are sitting directly on your skin, and you're absorbing that, you're wearing it all day, especially if it's workout clothes and you're sweating in those and absorbing the toxins you just released from your sweat and the
Right.
ones that are on your clothes. So, um,
Exactly. This is just an opportunity as a functional medicine practitioner to really educate our patients, right?
yes,
That's such a big part of our practice, is to educate them on these things. And most often our patients aren't aware of this.
yes, exactly, exactly. I think our most powerful role as a functional health practitioner is being a teacher,
Mhm.
and just teaching people so that they can make better decisions and better informed decisions.
Absolutely.
Now, the second sort of root cause that we're going to talk about is kind of related to endocrine disrupting
Mhm.
chemicals, but it is inflammation and oxidative stress. And so I think we talk about inflammation probably every episode, but it's an issue in our country for sure, chronic inflammation. But let's talk about it specifically as it pertains to endometriosis. So let's start by taking a look at an image from a study in 2023 from the International Journal of Molecular Studies. Now, this is a little bit of a complex image, but I'll walk you through it. Essentially, this study explored kind of the understanding of how oxidative stress is both a trigger and kind of a cause of endometriosis, and particularly its association with infertility. Now, this really in particular is talking about mild to minimal endometriosis. But essentially, let's start at the top left corner. Um, Usually, we're looking at a woman with endometritis, because endometriosis doesn't just immediately start as endometriosis. Usually, a woman has a inflammatory condition that has progressed, and so endometritis, which is inflammation of the endometrial cavity and endometrial tissue, often caused by a bacteria called Enterococcus faecalis. Um, that is a gram-negative bacteria that can cause inflammation. Now, the presence of this bacteria and this inflammatory condition of endometritis is going to release reactive oxygen species. And so the reactive oxygen species can also be caused by age in general, um, also immune activity or increased immune activity, as well as the presence of certain conditions like PCOS, endometriosis, as we're discussing. Those can lead to lower production of antioxidants. And so you have less of that protective um, field of antioxidants that can kind of fight off those reactive oxygen species. As we see as we go towards the right of the image, that ROS or reactive oxygen species can damage our DNA. It can change the egg structure. And so that can impact the egg that is released during ovulation. It can actually drive the aging process of the oocyte and make the egg a bit less suitable for fertilization. It can also lead to cell cycle arrest and change the way the DNA is present in the oocyte. And then also, it can upregulate some of the inflammatory markers as well. And so we can see that when this inflammatory process is not mitigated early, we don't pay close attention to the presence of inflammation early in this process, it can lead to further damage of the tissues and even impact the health of the eggs that are present in the ovaries, particularly that one that turns into the oocyte that's hopefully going to be fertilize that cycle. So, with women with endometriosis, it's important to consider um, knowing that they are in an inflammatory state. We also should understand how those inflammatory markers are connected to pain. So, as we know, inflammatory cytokines like interleukin 6 and TNF alpha, they promote both local and systemic inflammation. And that inflammatory process is directly associated with pain. And not only does it perpetuate pain, but also the growth of additional endometrial lesion growth. As I mentioned, those reactive oxygen species can cause DNA damage and just continue that cycle of inflammation. It can also lead to immune dysregulation, so further releasing more inflammatory cytokines. And unfortunately, that part of the immune system that is responsible for cooling down the inflammation just doesn't seem to get a chance to turn on and kind of facilitate the healing process. And then we also have to remember that another inflammatory marker that we don't talk about a lot are prostaglandins. Now, prostaglandins are naturally present in our body. That's one of the things that can cause the painful menstrual cramps. But increased levels of prostaglandin E2 drives inflammation and is driven by inflammation. And prostaglandin E2 is known to amplify pain and the proliferation of lesions. So cooling down the inflammatory process and fighting off those reactive oxygen species with antioxidants is going to be incredibly important. Now, to learn more about the root causes of chronic diseases like endometriosis, and also to learn more about women's health and men's health conditions, please don't forget to log into your platform to dive deeper into functional and integrative medicine solutions for your patients. So, now that we've talked about the ways that endocrine disruptors and chronic inflammation actually kind of set the stage for endometriosis, where do you start when it comes to looking into your toolbox and kind of figuring out what to do with those patients, what direction to go in first?
Yeah, so let's go into discussing at least one natural solution, right? Because
Yeah,
we want to focus on some clinical application here as in functional medicine. So we want to offer an alternative without more drugs and then also lower side effects for our patients, right? So what can we do for our patients who have endometriosis? Let's pop up a picture here and give you a few options that may be beneficial. Okay. And so these are a few herbals that you can use. Let's see how good I remember my herbal medicine. So Scutellaria, that's going to be skullcap. We have Panax ginseng, self-explanatory, curcuma or curcumin or turmeric, and polygonum. I think that is some that that one is not weed. And then we have camellia, which is tea. And so all five of these herbals can be great for endometriosis. And as you can see on the left-hand side here, this goes into some of the impacts that it has on endometrial tissue, on some of the hormones, on the oxidative stress. And what we want to focus on for today is one thing that you could do for your patient. So we want to focus on one of these primary herbs, and it's going to be curcuma. So we want to take a look at some of the data. This was from a blind study. This was published in 2024, and this was in the Journal of Phytotherapy. What they did was they did a triple blind randomized control trial, and this was on women that had a confirmed diagnosis of endometriosis related to pelvic pain. Their intervention was oral curcumin supplementation versus a placebo. What they measured was pain intensity, quality of life, and then potential markers of inflammation. The patients were given The treatment group was given one curcumin capsule with a dose of 5 milligrams twice a day, 500 milligrams, and this was for 8 weeks. What the results showed was there was a significant reduction in pelvic pain in the curcumin group compared to the placebo. They also had improvements of quality in life scores, and there were no serious adverse effects reported, confirming that curcumin was good and tolerable and had a good safety profile. So what it concluded with this study is that herb in the middle, curcuma, it's showing that curcumin is a potential complementary therapy for managing painful symptoms and endometriosis. So if you have a patient that is having and reporting pelvic pain, curcumin may be an option that you recommend to them at 500 milligrams twice a day because it has the anti-inflammatory, the antioxidative stress mechanisms to mediate some of those benefits, right? And we know that there is oxidative stress effects now with endometriosis. We also know that there's inflammatory effects that is impacting endometriosis as well. This handles both the inflammation, oxidative stress, along with other mechanisms. So curcumin can be a really, really good option for your patients. And this is non-hormonal. It's low risk, it has symptom relief, and it's really helpful for women who are seeking alternatives to things like NSAIDs or other hormonal treatments. And this is the citation for that. It's called The Effect of Curcumin on Painful Symptoms of Endometriosis. And then we also want to offer you a professional grade supplement that both Dr. Sarah and I have used for our patients, and we've seen the clinical benefits of this. It's by Da Vinci Labs. It's curcumin C3 complex, and it has the exact dose, which is 500 milligrams per capsule. Again, you want to do that twice a day for your patients for at least 8 weeks.
Yes. I'm so glad that we highlighted a product that is so common. I think everyone loves turmeric and curcumin,
Mm-hmm.
but there's strong clinical data, showing that it's been shown to help reduce that pelvic pain. And apologies if you hear my dog barking in the background.
That's so cute. But yeah, going back to that with the curcumin, right? It's you need to know the correct dosage and how to apply it in the clinical setting, right? So oftentimes your patients might come to you and they say, I've been using curcumin, but then when you take a look at the supplement, it might not be at the correct dose, or it may not be a high quality curcumin supplement.
Exactly. Because we know, the studies have shown, it's been well documented that curcumin's bioavailability isn't the best. And so we
Mhm.
need to have a couple of other add-ons to make sure that we can absorb as much of the curcumin as possible. Such a good point.
Absolutely. And that supplement does that.
Exactly. I love Da Vinci Labs.
Me too.
Wonderful. Um, I think we have a question, but before we get to the question, I did want to highlight the fact that today we're sharing a scholarship for our functional weight loss certificate program, a $2,000 scholarship. And that makes the enrollment only $950 until the end of the month. Today is the 21st. So you all still have some time to sign up and take advantage of the scholarship that we're offering. As well, if you do not haven't had a chance to, please put your questions in the chat. The Functional Weight Loss Certificate Program is an 8-week live and on-demand training that will show you how to transform your patient's body and energy levels by finding and addressing the factors and the root causes to weight gain and obesity. So let's go to the question. Karen Smith would like to know, is there any correlation with endometriosis and vaginal atrophy? Dr. Chill, did you want to start?
There's definitely some correlation with that. Oftentimes you will see in your patients that they have as a symptom of endometriosis some vaginal atrophy that coincides with that. Is that what you're seeing with your patients as well?
Yeah. And oftentimes, especially if they've been treated with, estrogen blockers, that
Mm-hmm.
is one of the side effects because, our estrogen is the thing that gives the texture to the vaginal tissue. And so that can be a painful or uncomfortable side effect as well. So yeah, that's something that we've seen. Yeah.
Great
Any
question.
other questions? All right. Thank you all for joining us tonight. We had a wonderful chance to chat about the two main root causes of endometriosis as exposures to endocrine disrupting chemicals, as well as chronic inflammation and oxidative stress. As always, if something that we talked about on here jogged your interest and your memory, please go back, log into the dashboard, go back through your modules, refresh your memory, get back to being familiarized with certain topics. Great question. I'll get to that second question in just a moment, but make sure you go back into the dashboard, Go back through those modules, particularly maybe the women's health and inflammation modules as well. Okay, so the question would be, would the management of endometriosis with vaginal atrophy be the same? Usually, yes, but I add in some elements to address that vaginal atrophy. Usually, I'll opt for like a calendula-based vaginal suppository to help nourish the tissue. And then if they're on estrogen blockers, maybe discuss a protocol to help get the same benefits that we're looking for, but use a different mechanism of action. So we're not blocking too much of that estrogen that we get vaginal atrophy, but we're still not having the incredibly painful periods and lesions. What about you, Dr. Cho?
Yeah, absolutely. It's really looking at are they on the medication and having a discussion with them? Are there ways that we can look at this from a functional medicine perspective where we can help them to metabolize those estrogens properly, right? Without the estrogen blockers. And then so they're keeping the estrogen that they need while metabolizing the excess that they don't. And that kind of helps with the root cause aspect while you're doing like things like the calendula vaginal suppositories, nourishing the tissue as well. It's about nourishing and figuring out the underlying causes.
Exactly, exactly. Because if we just focus on the symptom management and you're just offering a band-aid, and sometimes, supplements and other holistic modalities can be used as a band-aid too if we forget to address the root causes. So,
Absolutely.
very good point.
Great questions.
Yeah, very good questions. You guys have time to squeeze in one last one? But yes, don't forget to take advantage of our scholarship for the Functional Weight Loss Certificate program. I've had the honor of chatting with folks who have finished the program, and they have had glowing reviews. They've talked about how they feel so much more confident and competent when supporting patients on their weight loss journey. So if you've been on the fence, now's the time to do it before the end of the month.
And I've taught some of the live classes, and the questions and the engagement in these classes are awesome. And so it's actually the reason why I haven't been able to do some of these podcasts is because I've been teaching some of the weight loss certification live classes. And it is it's a very thorough program. So we really go through all the aspects from a functional medicine perspective of all of the different contributing factors that aren't often addressed in weight loss. And that's why many patients are still not able to maintain their weight loss. So this goes into all of the aspects and how to get them to lose their weight and get to their health goals, but also to keep it off long term. And then we go through all of the different strategies as well.
That's right. All right. I don't see any more questions. So, as always, have a wonderful day and evening. And we will see you all next week at the Functional Solutions podcast with the American Academy of Functional Health. Thanks, everyone. Have a great night.